Hi, it's Holly. Welcome back to 5 Minute Birth Classes. Today we're talking about reasons to call your midwife. And now when I say midwife, whoever your normal pregnancy carer is, okay? Also a disclaimer, I do not know you, I don't know your pregnancy, I don't know your baby. So if you have been told to call your care provider for any other reason, you need to do that, okay? All right, so any sudden onset of tummy or back pain is really important to call about. If you think that you're going into labour, especially before 36 weeks, if you think that your waters have broken, especially if there's any weird colour to them, if they're like yellow or green or red, that's really important to call about. If you have any changes in your baby movements, so if your baby movements suddenly reduce or like become excessive after the 28-week mark, or if you're concerned about them at any other point, you call, okay? If you think that you have a fever, especially if it's one that you can't control with Panadol, and rest and hydration and all those things. If you faint or you have any loss of consciousness, if you have any abnormal vaginal discharge, so really normal in pregnancy to get some discharge that we call leukorrhea, but if there's anything that is like irritating, if it looks weird, if it smells weird, if it worries you, you get it checked out. Leukorrhea is very similar to the discharge that you get when you're ovulating. So it tends to be like a clear to white colour and usually like a mucousy to slightly watery mucousy consistency. If you have any like bleeding in pregnancy, so your cervix has this really big blood supply, so you might find that you get like a couple of spots or just a smear on wiping after you have sex or after you get maybe like an internal ultrasound or something. But as long as you're otherwise feeling okay, baby movements are fine, no concerns, it's normally okay, although I would still definitely recommend that you call somebody to check. But if you have any like sudden onset or unprovoked cause of bleeding, if it's more than 5 cents worth, if it's ongoing, if it's painful, if it correlates to anything else, so if it also occurs with like a change in baby movements or you're feeling unwell or anything like that, you need to call somebody, okay? If you get any sudden onset of swelling, especially like puffiness to your face, your hands and your feet, that's really important. That can sometimes be blood pressure related, when your blood pressure goes too high. If you think it's just weather related, then once you're cool and comfortable, shoes are off, you're having a rest, you've had a cold shower, something like that, if it does not self-resolve with that, then you need to call somebody, okay? If you get any spots or sparkles in your eyes, so again, this is like a high blood pressure related one. So people can get like flashes and weird little like sparkly spots in the eyes. Important to talk to somebody about that. If you have any headaches, what we call frontal headaches, especially, so headaches at the front, that are not relieved with Panadol or whatever like simple painkiller that you can use in your country that's safe in pregnancy, that is really important. That's often sometimes a higher blood pressure side effect. That will also often come with a side of like reflux that doesn't go away with just your normal over-the-counter remedies. They do not have to happen at the same time. They can be totally separate, but you do need to talk about it. If you get any uncontrollable gastro, so diarrhea and vomiting, or if you have a bladder infection or you think you might have one. Now, both of those are important because they are both neighbouring your uterus, and sometimes your uterus will get irritated because of its neighbour being irritated, and for some people that will actually put them into labour, so super important for that one. And then if you get any crazy itchy like feet or like palms of your hands, you also need to call somebody. That can be like a liver or a gallbladder upset in pregnancy. And then if you have any worries, if you are concerned, if you think, oh my goodness, this is not normal, it does not have to be on the list for you to need to call somebody, and we would much rather hear from you and everything be fine than for you not to call and for something that, you know, needed to be treated then and there, for that to be missed. Have a great day.